In the 30 plus years I've been trying to develop immunotherapy for pancreatic cancer, this is the first time I am really excited that we're making progress. And I've been working on vaccines for a long time, but we didn't know what the antigens were. We didn't have immune checkpoints. Now combining antigens that we know, so vaccines that contain antigens we know are important, and immune checkpoints have led to being able to see responses in our patients. In particular, we're able to give our immunotherapy in the neoadjuvant setting, so before patients go to surgery. And what we're finding is even 2 weeks before surgery, we're seeing shrinkage of the pancreatic tumors at the time of surgery, just 2 weeks after one dose of vaccine with one dose of immune checkpoint therapy. This is very important because we have never seen this in the many years that I have been doing this. So I'm very excited. We're also able to study the tumors and understand why is this patient's tumor sensitive, or if a patient does respond, why are they resistant? And we're finding a lot of signals within the tumor's microenvironment that we can now give additional drugs that will help. And these are immunotherapy drugs that will help shrink the tumors even more so. So that's one area that really excites me. The other area is something I really thought of as a dream 30 years ago. I always wanted to develop a vaccine to prevent cancer. Yes, vaccines prevent virus infections. I've been always amazed at how much a vaccine can do in an infectious disease setting. Why not for cancer? Well, finally, I feel like I'm realizing this dream because now with the science that has uncovered what the earliest changes are in a normal cell, that starts that cascade of events toward a cancer. Now that we know what those signals are, and in pancreatic cancer, there's one gene, mutated KRAS, that explains over 90% of all of the pancreatic cancers I develop. And it's the first change in that normal cell. So we can now develop a vaccine, which we did. It's called mutated KRAS. And we're giving our vaccine to people who are healthy, but who know they have a family history of pancreatic cancer, or they have something abnormal on their CAT scan that tells them it will turn into a cancer. So we're very excited because we're able to give this vaccine to our patients, or to actually healthy individuals. And we can get their tumor sometimes and take a look, or their precancer, take a look what the vaccine has done after we've treated them. And we're finding that the immune system is getting in. So again, it's early, but my vision is that 10 years from now, we will provide a vaccine to individuals who are 20 or 25 years old to prevent them from ever developing pancreatic cancer.